Okay.
Hello, good morning.
Good morning, doctor.
Hello, my name is Dr. Hala. I am the surgical resident at the hospital for today. I have some of your notes here with me. Perhaps, but if you could tell me on your or onwards, what's going on?
Okay, doctor. I have seen my GP because I have mass.
Mm-hmm,
Yes, and he told me it's not cancerous, and
mm-hmm,
I'm a little bit worried.
mm-hmm. Okay, just to clarify this, you are here today because you have a mass and you are worried about it's maybe cancerous. Am I right?
Yes, and the surgeon said the surgeon has consented me for the procedure, but I
Mm-hmm.
don't know if I want to go further.
Mm-hmm. Okay, I'm really sorry to hear that. It must be very stressful for you. Firstly, let me reassure you that in such condition, the risk of cancer is extremely low. Am I clear so far?
Doctor, how can you know if it is cancerous or not?
Mm-hmm. Okay, this is a very good question. Let me explain to you that the mass will be examined under the microscope, and you will normally get the results after a 2 weeks review in the 2 weeks review in the clinic, and also the wound will be checked then in the clinic. How do
Uh-huh.
you feel about that?
That's good. But why it take a lot of time? 2 weeks is a long
Mhm.
time.
Okay, okay, this is a very good point. Let me clarify to you that this 2 weeks is the minimum time for the result to be to come from the lab. And also, I would like to inform you that after the surgery, there will be a scar, as the lesion is a large, it's a large mass, but it will fade with time. Um, how does that sound for you?
Sounds good. Doctor, I
Mhm.
have another question.
Well,
I go to the swimming pool every day, so I am afraid that this will leave a scar on my back.
mhm, okay.
So, what can you do to minimize the scar?
Mhm. Well, let me explain to you that this scar will be minimized by many measures. Firstly, keeping the area dressed with stress tips for a month can help to minimize the scar greatly. And secondly, the surgeon will also discuss with you further management to minimize it as much as possible.
Mm-hmm.
Can
Good.
do you think you can do that?
Yes, sure. But
Mhm.
what if the surgeon didn't remove all the mass? What if some of it remains? How does he know that
Mhm.
he removed it all?
Mhm. Okay, this is a very fair question, and let me reassure you that the surgeon here is a very expert, and he will remove all the mass from your back, and there is unlikely to be a recurrence again. Am I
Mhm.
clear so far?
Yes, doctor.
Mhm. Great. Do you have any other concern?
No, thank you.
Thank you. I hope you a speedy recovery, and if you have any concern, don't hesitate to contact me. Thank you.
Thank you. Thank you.
Okay, thank you, Dr. Amir.
Well,
هلا I just want to mute as well. طبعا وهذا السيناريو متكرر ديما يصير شنو هو when you start with a very very strong beginning you will lose the card for sure. What happened here that Hala she started with a long very long start and she took like 20 seconds talking about herself Hello, my name is Dr. Hala. I'm the surgical something, and I know you are here. So it was like a big, very long one. And then, so this is a greeting introduction. Listening sounds was good. There is no sympathy. So he has worries. Okay, I really appreciate your worries. You have to start with this one. But what happened here? You started with clarifying information, and am I right? This one is good. And after that, you said, "I'm really sorry." So it's not, you are not sorry now. It's fake. I can feel it. It's not the real one. The real one has to come once the patient finished his problem. So he's here today to take his lipoma off, and he's a bit worried. Oh, I really appreciate your worries, but just to clarify that you are here because of this and this and this. Am I right? Yeah, this is the good sequence of performing sympathy. It has to be straight away after the problem. Firstly, here you said firstly, but there is no secondly or thirdly. The patient asked you a question, you've been like hesitant because why you are hesitant? Because you didn't ask him questions. So you have to ask him first. First of all, ask open question or maybe more than one question, and then you can go with the reassurance, explain whatever after that. But first of all, you have to start with the open question. Okay, hesitation. There is a hesitation, a lot of hesitation. Let me explain. In task number 3, I think here, and he asked you a question. He asked you here question. How you know it's not a cancer? I think you've been like hesitant because you couldn't find the question, the answer here. But what happened? You jumped to the next task. You explained the scar issues, and then he asked you again about the scar. Why? Because you went through both tasks at the same time. So here we can see your performance. You lost the card at this point because once you finished the explanation, he asked you the same question, that he's going to the swimming pool and he's a bit worried about the scar. And this question was shocking to you because you couldn't answer it properly because you already explained the scar things. You have done very well labeling, but no highlighting. Do you think you can do that? It was like a bit delayed, and there was a hesitation as well. Let me assure you, the surgeon will take all the mass from your back. This is a bit judgmental. You should talk more about the mass rather than his body or his back. Am I clear so far? The last one is good. Okay. Yeah, okay. So Rana, she's asking, what if we did not she's wondering if she can just go through the card without greeting and introduction. Okay, good question, Rana. So what happened in the assessment? There will be like a table like this. Okay. And there is things like greeting and introduction, fluency, intelligibility, confidence, building relationship with the patient, non-judgmental talk, purposefully and prospectively going over the tasks, language, everything like this. And there will be a score like this, I think, from 0, maybe 1, 2 and 3, something like this. So if you have done very good greeting and introduction, you will have 3. A little less than very good, you will have 2. Poor or something like very low, you will have like 1. If you don't want to do greeting introduction, okay, you'll have 0. But you can go, you can start with the or for example, listening sounds. If you have done very well listening sound, your listening sound, you will have 3. A little bit less than very well, you will have 2. A little more, you will have 1. No listening sounds, you will have 0. Okay, it's okay. So let's go with the open question. You have asked all the questions that you have, 3. Less than all the questions, 2. Just one or question or very poor question, 1. No questions, 0. Okay, let's go over the next one. And then they will give you the mark according to what you have or been doing over the tasks. Okay, so this is a very like primitive explanation. Okay, so yes, okay, it's okay, Hala. Okay, you can start.
Hello, my name is Dr. Nusayba. I am the doctor on charge today. Please tell me, what can I do for you?
Can you please give me just few seconds, okay?
My name is Dr. Nusayba. I am the doctor on charge today. Please tell me, how can I help you?
Okay. Actually, for some time now, I noticed a swelling in my back, and I have been seeing my GP for the last few weeks, and he told
Okay.
me that this is a benign lipoma, which I'm not convinced because how can he know that it's benign just by examining it? So I'm waiting now for a procedure to remove it, but I'd like to be reassured about some issues. Can you please help me?
Okay. Well, I am so sorry to hear that. I know it must be really distressing for you waiting for the results. Just before we proceed, may I ask you a few questions?
Yeah, of course, you can ask me.
So can you tell me more about that?
As I told you, I noticed that swelling. I went to the GP. The GP diagnosed it as benign lipoma. I'm not convinced. I came for the procedure to remove it.
Okay, I understand. And do you have any chronic medical condition?
No, I don't.
Okay, just thank you for sharing that. Just to summarize what you have told me, you have noticed a swelling and you have noticed a swelling in your back and you went to the GP who suspect that it could be benign lipoma. And now you are waiting for the results. Am I correct?
Yes. Okay. Yes, correct.
Okay, so let me reassure you that it is very unlikely for this swelling to be cancerous. How do you feel about that?
These are great news that I have been told by the GP before. Great news, but I'm not convinced.
Okay, well, I understand that you must be really concerned, but let me explain for you that the sample that was taken from the swelling will be examined under the microscope, and they will provide us with whether it is benign or malignant, whether it is a benign or a cancerous lesion. How do you feel about that?
So we are saying that you will know for sure after the examining the sample taken from my back. That's right?
Well, that's a good question. Yes, we are waiting for the results of the examination, and it will provide us with the type of the lesion that you have.
Okay, they told me this will be in 2 weeks. Can we know
Yes.
it before that?
Well, I understand that you must be concerned waiting for the results, but actually the thing is examining these examples and these samples under the microscope usually takes about 2 weeks. So we're going to be holding on for 2 weeks before we can have the results. How do you feel about that?
It sounds reassuring, but
Okay.
I'm a little worried about the scar post-operative. This is scar. Yeah, is it going to be fixed? I'm not going to get rid of them, or what do you think? What can I do to get rid of them?
Okay, well, your concerns are perfectly understandable. So let me explain for you that there could be a scar after the lesion is removed, but I can provide you with few measures that can help the scar healing. Are you interested?
Yes, of course.
Okay, so the first one is I am going. The first one is I want you to keep the scar clean, and the second one is to keep the scar covered, and the third one, most importantly, I'm going to provide you with an ointment that is going to aid in its healing. Do you think you could do that?
Yes, I think I can do that. And
Okay.
another concern, what about the recurrence?
Okay, time is up.
Okay.
Thank you, Dr. Susu. Time is up. Do you
Okay.
think you can do that? This is the last thing. I give you full 1 minute, but unfortunately, you couldn't keep up with this. Okay. Okay, so what happened here? The card starts good. The start was good, okay, but then you lost the card. Again, the patient is the leader. What we can feel here that the patient is asking question and you are answering questions. Greeting and introduction at the beginning was good. The listening sounds good. Sympathy was good, and it was in the right place. Before we proceed, this is I'm posting good. Number 4, open question. You asked 2 questions. Good. This is open information gathering. Thank you for sharing this information. This one is good. And then you said to summarize. This is not a summarization. You can say like just to clarify that you are here because this and this and this. This is number 1. Or I just want to make sure that I understood you completely. Or I just want to make sure that I have got all the informations you have told me. And then you can go like this. Okay, this one, these 3 things is very good. Try to use one of them. Now, this one, same posting again, very good. Let me reassure you. Okay, you have done reassurance, but how, what is the basics? For what you are, how you are reassuring? You didn't ask any question about the lipoma. Here you should, for example, if it was me, first of all, I have like a very nice paragraph here. You can see that the patient is waiting for the surgery. So the surgery is not done yet. So there is a large benign lipoma and it was in the back. So you can ask her like how big it is, the lipoma, or how big it is, the mass. Yeah, it is quite big. And where is the mass? It is in my back. Okay, thank you for sharing this information with me. Now, let me assure you that according to the my history and the place of the lesion or the mass, I can reassure you that the risk of cancer is extremely low. Here she will ask you how you can confirm this without the biopsy or without taking out the mass and examining it. Okay, this is very good question, but let me reassure you that usually when the mass is a bit big and it is in the back, it has the features of being benign. How do you feel about that? Then she would be like so concerned again So now you can explain for her that to make sure that it is benign, you have to send the specimen to be examined under microscope, and this will take about 2 weeks review. Meanwhile, we will be here to check on the wound and to make sure that there is no infection or whatever you want to tell her. How do you feel about that now? Okay, yeah, so it's a bit like you should be like a bit more comfortable with your answer now. I have just one more question. I like going to swimming. So do you think that it will leave a scar? Oh, this is very important question. Let me explain for you that according to the size of the mass, I believe that there will be a scar, but it will fade with time. Am I clear so far? Yeah, doctor, how can it, how, if it is like a big, how can I do, what can I do to facilitate or to accelerate the fading process? Oh, this is an important question. Let me explain for you. Number one, number two, which is very important. And then the number three as well, you can ask this to put this as well. Do you think you can do that? Finally, here you can put finally, and by this way you can go over the task. How do you feel about that? You mentioned, you used this, how do you feel about that? 3 times in row, you know, in row. It means يعني استعملتي how do you feel about that 3 مرات ورا بعضهم. So this is for sure repetition. Once you started your answer with actually, it means that you are not sure about that. So be careful with using actually, because in the same sentence you use it something like the thing. So you are making up things. Now here you are not sure about your information. How do you feel about that? Again, here we can see that in the second half up to here, you were good, but then the patient is the leader, and then you said, I want you to keep. So this is order in advice. You use the order. There is labeling and highlighting, which was very good. I will provide you. Again, try to talk about the problem, not about the patient. Do you think you can do that? Very good. You didn't cover the last task because you spent a lot of time here struggling with the patient, but good performance. Thank you, Nusayba. So,
Yes.
okay, thank you, Nusayba. Now, Nusayba, you will be the patient. Susu, you will be the doctor.
Okay.
Okay, you can start now.
Good morning. This is Dr. Abdurrahman, the surgical resident here. It came to my knowledge that you are waiting for a surgical removal of a lump in your back, and you have some concerns that you need to be answered, and I am here to help you. Can you please tell me what is that concerning you?
Hello, doctor. Yes, I
Hello.
have a large lump on my back, and I am a bit concerned that it could be cancer.
Mhm, mhm. I understand that. It's very appreciated that you are concerning about the lump in your back. It's completely understandable. And it's written here that the GP diagnosed it as benign lipoma. Did he explain to you?
He said that it is a benign condition. It is not cancer, but
Mhm.
I am not really convinced about that.
I understand that. Okay. And I'm so sorry that you are feeling like that. But from the notes here written, I believe that the cancer is the possibility of cancer is extremely low, and we will know for sure. Of course, after the procedure, because after the procedure, they are going to examine take the sample and examine it. Do you want me to explain to you further about that?
Yes, yes, please.
Okay. So After the procedure, they are going to take a sample and examine it under the microscope. It should be obvious that from the microscopic and histopathology of the swelling, if it is cancer or not. And then they are going to give you the results in your next appointment in the outpatient. Are you, yeah, is that clear for you now?
Yes, it is clear, but they've told me that I can come for the results after 2 weeks. Why is it taking so long?
Okay, so yeah, I'm sorry that you have to wait this long, because I understand that it must be very frustrating for you to wait for the results. But firstly, as I told you, I reassure you that you don't have to worry. And again, these 2 weeks is a must, because that is the time it needs to complete the examination and give you the results. And do you have any other or further concerns?
So after these results, we will be sure that if it is cancerous or not?
Yes. After these results, yeah, I appreciate your question. After these results, we will be it will be clear that the nature of the lump a cancer or not.
Okay. So, doctor, I'm a bit worried after the procedure. I will have a scar on my back. What can I do to minimize it?
Appreciate that concern. Yes. Yeah, I believe that he will have a scar after the operation, of course, but this scar will fade away with time. Okay, and in order to make sure about that, regular dressing will be conducted in the clinic, and like a month or something, you are going to come for regular visits for this. This will be very good to will minimize the scar. Is this clear for you?
Yes, it is clear. Another thing is, if there is a chance that the surgeon might miss some of it, I am really worried about this.
Okay, I appreciate your worries, but I need from you to be rest assured that the surgeon is well trained, because we have done these operations for several times, and he's well trained for this, and so don't worry about that. And also the surgeon will discuss with you further about this issue.
Okay, thank you, Dr. Susu. Thank you, Dr. Nusayba.
Thank you for you.
طبعا اللي صاير هنا ان what we can see here. Let me first mute you on. Greeting and introduction again, very long greeting and introduction, guys. At this point, I think we need to bring the marathon thing again. So in your life, whenever you are doing something, you have time, okay, and you have the force or the effort. If you are starting, let's say with Ramadan, okay, if you started the first days with doing like too much food, by let's say 15 or 20 days of Ramadan, you will be like, okay, let's do just one thing, and that's it. But if you started doing like normal things plus one or two things, you will be able to keep up all the way until the end of Ramadan, or praying or reading Quran or whatever it is. But if you started something with pushing all the way up, at some point you cannot keep up with this thing. And this is exactly the idea of the marathon runners. If they are doing like marathon for 5 hours, what they will do, they will just jog. Okay, they will just jog. They cannot run. They do jogging. Okay, by this thing they can finish the marathon. But if they start sprinting, they will lose their force and they will not reach the end of the marathon. And this is exactly what happened here. You started very long greeting and introduction. You didn't give the chance to the patient to talk, and then you gave her the chance, so you have done listening sounds. She asked you a question. I understand. It's completely understandable. So this is two forbidden sentences or two forbidden explanation. Try not to use I understand, because in the exam he will tell you how you can understand my situation. But you can say like, I appreciate your worries. I appreciate your concern. I can see that you are frustrated. I can see it's a bit difficult situation. But guys, try not to use I understand. I am so sorry that you feel like this. Here, what I can see here that you have a good accent, okay? But you are pushing the patient and pushing yourself to the end of the car. So try not to rely on your English language, but try to focus on the criteria more, because you have criteria. If you can follow or cover the 10 criteria, I can assure you that you will be fine. Here, whenever the patient talk, you will say, okay, yes, yeah. So this is informal. Try not to use this one. During the explanation, you used histopathology. So this is Judge Jurgen's speech or medical term. If you use histopathology in the exam, he will ask you, what do you mean by histopathology? And this is not a good and this will give a bad impression to the examiner, because it means that you are using medical terms. Oh, okay. So yeah, I'm so sorry for you to wait. Again, the same informal reaction. You said, firstly, you don't have to worry, but there is no secondly, nothing. And then you said, and do you have any other question? So you missed the chance of labeling and highlighting. Yes. So this is informal again. I appreciate your worries. This one is good. So you have a lot of hesitation in your performance, and there is something called filler. This one called filler. When you don't have or you are thinking about the answer, you'll keep like and sometimes you're repeating one word like of the, and again down you use it the. So this is a repetition, okay? This is a filler. Try to organize yourself in the preparation time. Once you start talking, you have to be like more formal, okay? You will have a scar. So this is a bit judgmental, like a month or something. So you are not sure about your information. Try to be sure more about your information. Is that clear for you? This one is good. Okay. I appreciate your worries. Again, informal. I need from you not to be worried. So again, this is a bit order. Don't worry. Again, this is a bit order. To be honest with you, the English language is good, but you are a bit pushy or a bit like you are in a rush, you know. If you can cover the 10 criteria, okay, with this fluency, I can assure you that you will have more than 400. But try not to be so hesitant or try to hold your horses if you can understand it. Try not to just go, try to focus, think, and then talk. Okay, don't talk and think at the same time, because this will give a hesitation and this will give a filler the histopathology. So you see you made a mistake. Okay, good performance.
Okay, okay.
Yes,
That's
the
really,
hesitation
yeah, thank you for
affects.
you. Thank you for you. That is a very, 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 very informative and good evaluation. Thank you. Thank you so much.
Okay, you are so welcome, Susu or Abdurrahman. Hala, does the hesitation will decrease the scores? Yes, it will decrease the score. So hesitation, it will decrease the score, intelligibility, fluency, judgmental talk, medical term, which is called jargon speech, threatening, if you are threatening the patient, so this will decrease your score. For example, if you don't stop smoking, you will have lung cancer. So this is threatening. If you don't stop drinking, you will have liver cancer, for example. This is threatening. You have cancer, you have diabetes, you have hypertension, so your child has something, so this is judgmental. This is hesitation, or filler sometimes. So there is also self-correction. If you have done like too much self-correction, again, this is this will decrease your score. Or so self-correction, hesitation, judgmental speech, medical term, threatening, ordering. Also ordering will decrease the score. Okay, guys, if you have any question. So here, Dr. Roa, she's asking about the difference between patient, the card, reluctant card, and refusing medical request, right? So it is the same one, but what is the proper question here? The proper question, do I have to convince the patient or the relative about my idea or not? Because usually, if you have a reluctant patient, the interlocutor from the beginning, he will tell you, I will be naughty or I will be reluctant. Why he's telling you this information? Because he doesn't want you to get nervous or to be disappointed or to be frustrated. And your aim here, you have to focus more on what? On covering the criteria. Don't give him shit. Don't just leave him, even if he has reluctance. If he is doing reluctance, okay, just leave him, okay? Your issue or your task is not to convince him, but you have to talk to him with respect. What do I mean by respect? Do not ignore his question. You have to respond to his question, and you have to address his issues. But just go over the criteria while you are talking to him in Arabic. يعني الفكرة شنو هنا؟ إنه هو من الأول بيقول لك راهو أنا ريلاكتنت. شنو معناها؟ معناها أنت ما تزعليش لو إنه هو ما اقتنعش بكلامك. أنت الهدف من الكارد إنك أنت تغطي الكرايتيريا وتغطي التاسكس. That's it. اقتنع ما اقتنعش، اسمع كلامك ما اسمعش، ما هوش موضوعك. انت مجرد انك انت بتمشي في الكارد زي ما هو كاتبين. ما تعطيش don't give false hope or wrong information or false promise just to make him convinced. لو مش مكتوبة المعلومة في الكارد ما تعطيها لاش. لو سألك على حاجة مش موجودة ما تقوليها لاش غير باش ترضيه، لأن هذه this will be considered as wrong information. But you have to go over the card. If he asked you the same question again, Oh, this is very good question. Let me explain it for you. Don't say as I mentioned, as I told you. Let me explain it again. Okay, let me explain it for you. Maybe you can do some paraphrasing. Okay, how does that sound? He will ask you the same question again. Okay, at this point, what you can do? Oh, this is a very good question. Let me explain it for you. But before that, let's talk about وبعدين تمشي للنقطة اللي بعد, and then you can go to the next question or next task. Okay, don't refuse, direct refuse. Don't ignore his question even if he is repeating the same question. So you have to address his question and then you move on to the next task. Okay.
Okay. Okay, what about request card there?
The request. Okay. Usually, if you have a request, you will have the answer in the same request. What do I mean by that? I will tell you now. Just give me a second. Let me see if we have a refusing patient request.
Yeah, it is a Sub-Saharan Clinic 2000 in June 2014. It is a card about a patient on warfarin and his son wants you to prescribe a new drug, but you think you need assessment of the patient.
Okay.
It is actually, it is the first card in the reluctant patient.
Okay, first card and reluctant patient. Okay, so what you have to be careful with the preparation, because a refusing patient request, you will have the answer in the same card. So here, what did he say? Tell the son that you will not write a prescription. So this is the trap. Okay, هذا الفخ متاعك انك انت ما تقولي ليش I will not. Guys, try not to use I will not, I can't. This is against medical policy. This is against hospital policy. This is against my ethics. Try not to use these words. Why? Because this is the table, and this is the patient, and this is your position. You have to be his friend. You have to be his friend, not his enemy. If you said I can't, you cannot gain his trust, or you cannot build a good relationship between you and the patient. So how can I do that? I have to find a way or an excuse to refuse a prescription. Usually you will have it in the same task. So here, what did he say? Tell the son that you will not write a prescription for patient, what? Without consultation. How can I do now? What can I say it now? So he gave it to me. Yeah, politely. I'm afraid. No, the same. Even I'm afraid that I can't. It is the same. I would be very happy to prescribe a painkiller for your father. But before that, I need to examine him first. Because he gave you the answer here. That no prescription without consultation. So I would be very happy to help you to do these things, but before that I need to do these things. Okay, let's see another task. You maybe Nidal, you are telling this by coincidence. Okay, you just find it now. Okay, let's see another card. Okay.
معلش دكتور ندر، ممكن قبل ما ننتقل لكارد تانية بس سؤال واحد في الكارد دي ذاتها.
اوكي.
يعني انا بسال العيان عن الايس، انه مثلا زي ده انا عرفت من الكارد انه هي اكسبكتيشن، حقوم اقول له do you expect anything in particular in the management plan. طيب لو هو في البدايه لما قمت قلت له how I help you today قام قال لي انا دايركت اعمل لي كده، في داعي اسال عن الاكسبكتيشن اللي هي عشان اخذ دايركت الايس ولا
لا مش ضروري. لا مش ضروري الايلتس تسالي عليها في كل حاجه. انت لازم تسالي مثلا اوبن كويشن. هنا عندك هلبة تشانسز انك تسالي اوبن كويشن لان عندك معلومات هلبة هنا، وعندك كذلك ممكن تديري exploring patients information. Have you ever heard about embolism? Have you ever heard about atrial fibrillation? What do you know about warfarin? So عندك هلبة أسئلة ممكن تسألها هنا.
Okay, thank you.
So okay, you see here why he is a bit reluctant to prescribe sleeping pills, because sleeping pills, you see, Why he's reluctant to prescribe sleeping pills? Because risk of dependency, and he gave you etc. What does that mean, etc.? It means that you can make up 2 or 3 more things in order to use labeling and highlighting. Okay, so this is another card. Let me see. Next one.
لكن ده انا هقوم اقول له انا ما هقدر اكتب السليبنج بيل عشان هي ممكن فيها ريست على الديبندنس كده، انا برضو ما رفضتها يعني ما بطريقه مهزمه انه انا ما هقدر اكتبها لك.
لا ما قالكش قولي لا ما نقدرش. I'm a bit concerned that sleeping pills may cause number 1, number 2, number 3. I'm a bit reluctant to prescribe sleeping pills at this point because number 1, number 2, number 3.
Okay.
Okay, what is the, we need another one, reluctant patient. Reluctant. These are not reluctant. Okay, I think this one is reluctant as well. Express your concern as high blood pressure reading and explain that the condition increases the check. This is not refusing request. Not this one. So this is what you can see. Whatever you have, whenever you have refusing or something, you will have the same at the same time. You will have something. Okay, let's see this one. So here the patient, I think he's a bit, he has a stressful job and he wants sleeping pills, okay? But you have to explain for him again the side effects of sleeping pills, tactfully refuse to prescribe another prescription. What does that mean? Tactfully, politely, the same thing. I'm here, you should go with the refusing, but in the same way. I'd like to explain for you more that there is another ways or another methods to control the stress, just, and you go with the methods here, you can have non-medical issues with the same, given the same outcome. The card of issuing medical certificates. Yes, this that was what I'm looking for. I couldn't find it. The medical certificate, the one who got divorced, I think, and she is right. She wants to. Okay. Okay, you see here, this one is very good example. Refuse to issue medical certificate as your patient is not depressed. Again, I would like to help you during to do for this, but before that, I need to do some examinations. Here you will have 2 scenarios. Either she will refuse getting being examined, okay, or she will agree. If she refuses, I totally appreciate your concern, but in order to give you the medical certificate, it's important to get some investigations and examination first. So problem solved. If she agreed, no, okay, thank you for letting me examine you. Now the good news that there is no indication for a medical certificate, as there is no depression, no signs of depression. How does that sound to you? Here she will ask again, she will insist, okay, you have another way to do it, which is what? Either let me explain that issuing deliberately false or misleading certificate represents a professional misconduct, or you can start with this one. I totally appreciate your worries, but I'd like to ask you one more question. Have you ever heard about professional misconduct? Oh, this is very good, because this is exploring patient information. Oh no, doctor, what do you mean by that? Okay, let me explain for you that Issuing a deliberately false or misleading certificate represents what's called professional misconduct. Are you following me? Okay, now let me tell you that misuse of sick leave. So you see, now I already in task number 3. Misuse of a sick leave is a serious matter, as going on vacation while pretending to be sick may have consequences if the boss should question the medical certificate. How does that sound to you right now? So whenever you have a task, you will you need to prepare it well, and you will have the answer somewhere hidden. You just need to practice more to know all the answer. Okay.
I have a question.
Yes, please.
In this card, am I going to explain what a professional misconduct is?
Yes, but you need to get the as much criteria as you can from it. If it was me, I will start by exploring patient's information. Have you ever heard about professional misconduct? Okay, let me explain it for you, and you will go all the way. That's it.
So I explain it by what is written. So
Yes,
I will
yes.
say that.
Yes, the
Okay.
same, yes.
Okay. Okay, thank you.
Okay, you are so welcome. Okay, guys, so that's it. Tomorrow morning we'll have the same meeting if you want to do practicing, or we can go with writing. You will have this record uploaded on YouTube. Please, guys, I need you to go there, give me a comments, whatever it is, go good or bad. Subscribe if you can do it, and thank you.
Thank you.